OBC presents Diabetes is a growing segment of every optometric practice. Our guest speaker today will be Dr. Eric Botts, who has years of experience in the field of optometry and is a specialist in insurance billing, coding, and credentialing.
Diabetes is an epidemic here in the U.S. and quickly growing in all age groups. Most physicians recommend yearly dilated fundus exams for patients diagnosed with diabetes because it is the leading cause of new blindness for adults in the United States. As primary care eye doctors, optometrists are best positioned to provide that care for all patients currently diagnosed with diabetes. With an escalating population diagnosed with prediabetes, type 1 and type 2 diabetes, the opportunities presented to us are growing every day. Seeing these patients for their initial visit, followed by yearly or even more frequent office visits if needed, will fill your schedule quickly. Diabetes has been linked to many ocular diseases, including diabetic retinopathy, neovascular glaucoma, cataracts, tear film insufficiency, and corneal disease. Therefore, careful monitoring for possible development of such disease is the optometrist's responsibility. Coding for a diabetic patient requires no investment in new instrumentation. However, if you choose to monitor diabetic retinopathy, you will prefer to have a fundus camera, and an OCT is also very useful. Diabetics require a medical eye exam because it's typically their physician recommending it. The following diagnosis codes may be used for a medical eye exam, even if diabetic retinopathy is not present. The initial visit is typically coded as a 92004 or a 99204 if the appropriate history, elements of exam, and medical decision-making are performed. ICD-10 diagnosis codes for this exam have been updated for 2017 and include using Z79.4 for insulin-dependent diabetes and Z79.84 for non-insulin-dependent diabetes treated with oral anti-diabetic and hypoglycemic drugs. In addition, if diabetic retinopathy is present, the following diagnosis codes may be used. Also, you may perform the following procedures if diabetic retinopathy is found: extended ophthalmoscopy, threshold visual fields, fundus photos, OCT scanning laser, and electroretinography. Gonioscopy is a billable procedure even when no retinopathy is found. It should be submitted with E11.9 for non-insulin dependent diabetes and E10.9 for insulin-dependent diabetes. Be sure to monitor diabetic patients for ocular surface disease because it is reported to be found in more than 50% of all diabetics in the form of tear film insufficiency and blepharitis. Tear lab, inflammatory, and the keratograph 5M are useful tests performed to diagnose and monitor ocular surface disease associated with diabetes. Typical care for these patients involves a combination of office visits, laboratory, and supplementary tests. The additional tests may be performed on an as-needed basis dependent on medical necessity to monitor any change in the diabetic ocular disease. Some insurance allows for a baseline fundus photo, even when retinopathy is not present. However, most insurance requires that retinopathy is present to bill for imaging procedures, like fundus photos. Also, you should note that photos and OCT are both imaging procedures and are mutually exclusive, meaning most insurance carriers will not pay for them on the same day. For a patient with diabetes, A yearly eye examination is necessary, and some insurance plans even require documentation by the primary care physicians to confirm the eye exam is completed. This is necessary for the insurance to maintain a high HEDIS score, which many employers evaluate when deciding which insurance carrier will provide coverage for their employees. It is vital that you, the optometrist, share your findings with the physician treating the diabetes.
Thank you for watching. For any questions, call us, email us, or visit our website. We hope to hear back from you real soon.